Welcome everyone to the RBM Partnership Social and Behavior Change Working Group webinar on writing a strong abstract. Today's webinar will be presented in English and interpretation in French. Please select your language now. Unfortunately, Portuguese interpretation is not available for today's webinar. However, our interpreter will provide a recorded version of the call in Portuguese, and I will email the Portuguese recording along with the English and French recordings to the membership on Monday. Presentation slides are available in English, French, and Portuguese at the link on the screen and in the chat. I'm just putting the links in the chat now. One moment. Today's webinar will be presented in English, again, by our facilitators, Gabrielle Hunter, SBC Working Group Co-Chair, Lulu Masangi, SBC Working Group Steering Group, and myself, Ashley Riley, the Steering Group, or the SBC Working Group Coordinator. Thank you to all of our facilitators today for creating today's webinar to support the SBC Working Group membership in drafting strong abstracts. Thank you also to the steering group and the Francophone and Lusophone ambassador points of contact for their expert inputs in today's materials. I will begin the webinar today with an overview of the 2024 annual meeting. I am pleased to announce that the 11th annual meeting of the RBM Partnership SBC Working Group will be held in Nairobi from September 11th to 13th. The annual meeting is an excellent opportunity to convene malaria SBC professionals globally, to share experiences in malaria SBC through oral and poster presentations, present skills building workshops and participate in them, discuss emerging issues in innovative SBC, and set the working group priorities for the next year. As always, interpretation during the annual meeting will be provided in English, French, and Portuguese. Registration will open this July and will be announced through our email list. The registration fee is $250, and for National Malaria Program staff, there will be a few travel sponsorships available. The application for National Malaria Program staff will open in mid-May and will be announced through the listserv. So please stay tuned to our email list. Sponsorship is only available for National Malaria Program staff. And all of this information and more is available on our event website. You can see the link on the screen, sbcwg.drifta.com. I am pleased to pass the floor to Gabrielle, who will explain this year's call for abstracts. The floor is yours, Gabrielle.
Thanks, Ashley, and welcome everyone to this webinar. We're really happy to be able to share with you information about the call for abstracts for our meeting and some tips for your abstract to be as strong as possible. The call for abstracts did open already, and they are due by May 29th. Just like last year, you can submit abstracts in English, French, or Portuguese, and you can find all of the information about how to submit your abstract at our submission guide, and also templates that you can use to draft your abstract. And these can all be found at the links shown here on the slide. Next slide, please. So why would you want to submit an abstract to the RBM SBC Working Group meeting? First of all, it's an opportunity to present an overview of the work that you and your group have been doing, sharing both your results through data as well as your learnings with a group of SBC malaria professionals who do similar work. And therefore, it's also a great opportunity to receive feedback on your work. In those conversations that happen either in the question and answer session after a presentation or while you're sharing a poster, there's really great dialogue that can take place that then you can take back with you to inform changes that you might make to the implementation of your program, or if you're working on writing up a report, documentation, or manuscript of your program, the feedback can also be quite helpful. Next slide. The RBM SBC Working Group 2024 call for abstracts is accepting abstracts within 2 tracks. The first track is just like in previous years, reserved for country SBC updates from national malaria programs. So in this track, we want to hear from national malaria programs, and we would like to know what work they have been doing over the past year. So all national malaria programs are encouraged to submit. Only national malaria program co-authors should be on these abstracts, and we will accept up to 2 submissions per country. When you're writing these abstracts, think about the question, what have been our SBC experiences over the past year? And this could cover any aspect of a national malaria program's SBC activities, recognizing that programs do so many different types of activities. This is a broad category so that we can receive all of the great work that the programs are doing. They can write about strategy development, program design, implementation, monitoring, evaluation, coordination among SBC partners in country, or any other aspect. They are encouraged to present any data that they have available and reflections on those recent experiences, lessons learned, potential impact of the work, how they have overcome challenges, and future plans. The idea is to share learning and encourage others to learn as well. And then the second track for abstracts is called Sharing SBC Experiences. This is open to all working group members, and there are 4 themes. Next slide. So here are the 4 themes of interest in the 2024 call for abstracts under track 2. Every year we have slightly different themes. This year we are seeking to hear about your SBC experiences in 4 areas. 1, we'd love to hear about innovative and emerging malaria SBC. So abstracts in this category will describe new approaches and topics in malaria SBC. You can consider approaches like digital strategies, anybody who's working on malaria vaccine introduction, climate change and malaria, systems thinking, or any other innovative and emerging approach in your work. The second track is health equity, gender, and human rights. Abstracts under this theme would describe the impact of SBC programs that prioritize health equity, gender, and human rights in the malaria prevention, control, or elimination work. And please note, under this theme, a really strong abstract will be able to present data, either formative, intermediate monitoring data, or impact data. Our third theme are community-centered approaches. Under this theme, we are looking for experiences of malaria SBC programs that use community-centered approaches. A few examples include co-creation processes, adaptation of local tools for local use, community engagement, community health action groups. There are so many types of community-centered approaches. Similarly, under this abstract theme, a really strong abstract will also share data, formative, intermediate, and/or impact. And our 4th theme is called Scaling Up Malaria SBC. Under this theme, we are looking for case studies, best practices, or lessons learned from adapting or scaling up a malaria SBC project, either going from one context to another or going from a small scale to a larger scale. So, for example, scaling a successful pilot or a successful research project for broader application. So please note that under this theme, we are also looking for data, formative, intermediate, or impact data. Those will make your abstracts even stronger and help make the case for scaling up. Next slide. On this slide, you'll see the abstract sections that we expect you to complete for track 2. And please also note the maximum character counts that are permitted for each section. The sections are title, problem description, SBC intervention description, data collection and analysis methods, results, and conclusion. We'll go through each one of these sections in just a moment. But I did want to say that track 1 abstracts use a very, very similar format, and you can check the abstract guide for the details. But all of the advice that we share today for how to write a strong abstract is relevant to both track 1 and track 2 abstracts. Next slide. How to submit your abstract. You will need to submit your abstract through our portal on our meeting website at the link that's shown here. And you'll find very detailed instructions and templates to help walk you through that process. Those instructions are available in all 3 languages. And so now I am very pleased to pass the floor to Lulu Msangi from our steering group, who will share some advice on how to write each section of the abstract. So over to you, Lulu, and next slide, please.
Thank you, Gabrielle, and welcome everyone to this webinar. I will share a few tips for how to strengthen each section of your abstract. Next slide. Let's start by looking at the big picture here. This diagram is meant to show how each section of an abstract contributes meaningful to the whole. The most important advice we will share today is captured on the slide. There are 2 points here. First, each abstract section builds on the prior section. This means that we must be strategic when writing and make sure that each section clearly sets the foundation for the next section. And as you write, imagine that you are building a tower, 1 floor at a time. For example, the background section as the foundation should state the objective of the work. Then, the methods section should describe what was implemented to meet the objective. Next, the results section should report only the data from activities you described in the methods section. Finally, the conclusions can only be made, can make recommendations based directly on the data you presented. We will go over this in more detail in a few moments. Second, the whole abstract should stand on its own. What that means is that the reader should not need any external information to fully appreciate the work. That the whole story is captured in the abstract alone. You're probably wondering, but isn't it an abstract too short? How can it capture it all? What would that look like? For that, let us break down the abstract in each part. Next. The first sections are the title, background, and problem statement. The title of your abstract is very critical. Make it specific, direct, and interesting for the reader. Remember, the title is often the only thing that a conference attendee will read when deciding whether to see your presentation or poster. For the background and problem statement, keep it to 1 to 3 sentences in total. State what is known about the subject, including the location of the work, the primary problem, and the behavior of interest. Then explain what is not known about the subject and conclude with the objectives of the study or SBC intervention. For example, what did you set out to do with your work? Let's review an example together. This is not a real example. We created this example to illustrate a few points, but it is not from any real program. So looking at the week title side on the left, so it says SBC messages disseminated during community health education sessions. And the background says SBC messages to increase awareness of the importance of antenatal clinic attendance, and prompt care seeking for fever are important for behavior change. Tailored SBC messages were disseminated by community health workers during routine community level health education sessions. And now reviewing an example of a strong title and background. The title says Community Health Education Sessions tailored to address barriers to antenatal clinic attendance and prompt care seeking for fever in 3 regions in southern eastern Tanzania. And on the background, it says antenatal clinic attendance and prompt care seeking for fever are suboptimal in 3 regions of southeastern Tanzania. And according to recent qualitative formative research, several internal and social factors influence antenatal attendance and prompt care seeking for fever, including risk perception, self-efficacy, and community norms. However, community health workers may not know which of these factors are most important for a specific client, limiting their ability to provide tailored counseling. The program sought to improve community health worker ability to address the factors that influence ANC attendance and prompt care seeking. So can anyone volunteer by typing in the chat what they think makes the second version of the abstract better? If you can chat quickly, you can put in the chat quickly what you think makes the strong one to be strong. Any points? In the chat box, please. Looking at the title and looking at the background. The title is not smart. Thank you, Dana Dipo. What else? Looking at the weak and the strong. The strong abstract includes location. It states the problem and proffers a solution. Then Jacinta says the first sentence of the strong abstract states the problem. So thank you very much for your comments. Next. Next slide. So we highlighted in yellow some of the elements that make this version stronger. First, the title is more specific. It includes the behaviors and location of the work. Also, secondly, the background section indicates what is known, which is ANC and prompt care seeking are suboptimal in 3 regions of southern Tanzania, which are primary behaviors of interest, which are ANC and prompt care seeking behavior for fever. And what remains unknown or what the problem is, community health workers are not able to tailor their communication with clients to address the most relevant factors like risk perception, self-efficacy, and community norms. Finally, the last sentence clearly describes the program objective, which say they sought to improve the community health workers' ability to address the key factors their clients faced for these 2 behaviors. Next. So now that you have set the foundation, the building starts to get constructed with the SBC intervention description. In this section, you will describe what SBC activities you conducted. Make sure that you only report on activities that are relevant to what you wrote in the background section. Do not report on activities that did not directly address the objective you stated in the previous section. Otherwise, the reader will be confused. Try to answer the following questions when you explain your SBC work. First, how? If possible, mention the behavior change model, framework, or theory used. The what? Describe the SBC program activities conducted and who implemented them. The why? Explain why activities were selected to address the factors described in the problem's description. Once again, tie it back to the previous section. Who? Describe the specific population you focus on and why they were selected. The where, not the location of the SBC activities, and when, not the duration of the SBC intervention and how frequently people would be engaged. So let's continue with our example abstract, which we started with. So looking at this example, looking at the weak side on the description, it says community health workers were trained on using a segmentation tool and disseminating ANC and care-seeking SBC messages to targeted audiences. Community health workers delivered these messages during routine health education sessions. When you look at the strong example of a strong intervention description, it says community health workers in the 3 focal regions of southern eastern Tanzania received training on how to tailor community-level health education sessions to their clients' needs. Community health workers received training in the active listening, participatory adult learning, and motivational interviewing. Community health workers also received a segmentation tool to help them determine which barriers to ANC attendance and prompt care seeking their clients are facing, such as risk perception, self-efficacy, or community norms. The intervention was delivered during routine community-level health education sessions conducted by community health workers as part of their standard package of service for a 6-month period. So again, coming back to you, can you please volunteer by typing in the chat what you think makes the second version of the abstract better? What do you think we are saying the second abstract description is more strong and better? Can we get quick examples? Why are we saying the second one, the right one, is strong after reading it? Quick ones. Thank you. The weak one just mentions a tool and no explanation of what the tool is. The strong description is very explicit. Thank you. Describes the model used, location and duration. Thank you very much. And yes. So if we can move to the next slide. Again, we have highlighted in yellow some of the elements that makes this version a strong abstract. First, this version provides more detailed information on the content of the training, which community health workers were trained, and the objective of the training. It also provides further information that the community health workers received a segmentation tool that allowed them to better tailor what they would discuss during their health education sessions. Like we said in the background section, just before this one, the lack of tailoring to address the main factors with their client was the main problem. And when you read this section, it is clear that providing this training and tools to community health workers is how the program is seeking to directly address the objective stated previously. Finally, the duration of the intervention is noted as 6 months. Next slide. Methods of data collection and analysis. In this section, you will tell us all about how you collected your data. This is a crucial section to get right so that the reader is not confused when they read the results in the next section. Consider the following. Data sources. For data sources, you need to explain the data collection methods used and only those that are relevant to the results section. And for the study population, you need to include the sample size, how they were selected, and response rates when appropriate. That is, how many people were approached, how many participated. And on the time and place, list the dates and locations of the data collection. And on exposure, explain how you measured exposure to the SBC program. For example, frequency, dose, or intensity. And on analytical methods, note the data analysis methods, what were the outcomes, and other variables which were assessed. Remember that each section lays the foundation for the next one, as we said earlier. So the abstract should only include data collection methods that are relevant to what you'll present in the results in the next section. For example, we would not talk about conducting in-depth interviews in this section if there are no results from those interviews presented in the results section of the abstract. Then again, let's review the examples. So looking at the week one, the number of community level health education sessions and number of participants were counted. Then on a strong method, we see that it says activity level output data, example, number of community level health education sessions and number of participants were collected using activity tracking forms completed by community health workers and collected by the district malaria focal person on a monthly basis. Data were digitalized and aggregated at the regional level by the regional malaria focal person and transmitted to the NMP by email. Intermediate outcome data, example risk perception, self-efficacy, and community norms were collected monthly during the 6-month intervention using a rapid mobile phone-based survey. The surveyed baseline data were collected by random digit dialing of phone numbers in the 3 target regions, and subsequent rounds of data were collected by purposeful dialing of the community health education session participants. The mobile phone-based survey results were analyzed by the NMP using pre-post comparison and t-tests for statistical significance. And again, can we please type in the chat, what do you think makes the second version of the abstract better from the explanation which I just provided? If we can give a few points which makes the second one to be a strong method. Dan says a rigorous description of the approach with examples paints a clear picture of the process. Thank you very much. Any other thoughts to add? Details provided for methodology makes comparison better. Thank you very much. If you can move to the next slide, please. Thank you. So in yellow, again, we highlighted some of the elements that make this version a stronger abstract. There are lots of games here. First, they start with how they measured output data about the SBC intervention they described in the previous section. The authors explain how they counted the number of health education sessions conducted and the number of participants using tracking forms. So they use tracking forms. They clearly state that the tracking forms are completed by the community health workers and collected at the district level monthly. Then they explain how the data is aggregated at a regional level and then nationally. As for measuring the intermediate outcomes, which would be changes in people's perceptions, they clearly explain how they use a monthly mobile phone survey, which is an appropriate method to ask questions about risk perception, self-efficacy, and community norms, which are the primary factors of interest that they stated in the background section. Another strength is that they explained how they obtained baseline data and then subsequent rounds of data for comparison, noting how respondents were selected. And finally, they explained that the National Malaria Program analyzed this data using pre-post comparisons and t-tests, indicating the statistical methods. What else could have made this section even stronger? The authors could have included the sample sizes of the phone surveys. Next. Results. This is usually the longest section. Explain what you found in 3 to 8 sentences. Remember the building blocks. When you write your results, you can first go back and check the methods and only present results that came directly from the data collection and analysis you described in the methods section. Second, go back and check the objectives. The data must be relevant to the objectives stated previously. If your data is not relevant to the objectives as written, maybe you need to revise the objective. Then you also need to do a robust analysis. Stronger results include statistical and epidemiological best practices like pre-post measurements, comparisons with a similar group, control versus intervention groups, tests of statistical significance, like, for example, p-values, and measures of exposure to the SBC intervention, the dose and the reach. Again, let us review our example. So on the week results, it says community health workers conducted 1,567 community level health education sessions, reaching 16,786 people during a 6-month period from June to December 2023. When you come to a strong result, it says all 256 community health workers in the 3 target regions of southern eastern Tanzania conducted community level health educations. In total, the community health workers conducted 1,567 community level health education sessions, reaching 16,786 people during a 6-month period from June to December 2023. Results from the mobile phone-based survey indicated that only 43% of the target population at baseline believed they were at risk of malaria. Only 37% had the self-efficacy to attend ANC and seek prompt care for fever. And only 21% believed other members of their community attend ANC and seek prompt care for fever. At endline, 77% or with p-value of more than 0.05 believed they were at risk of malaria. Then 56% with p-value of less than 0.05 had self-efficacy to attend ANC and seek prompt care for fever. And 23% with p-value of more than 0.1 believed other members of their community attend ANC and seek prompt care for fever. So again, coming back to you, if you can give examples on why are we saying the second version is strong. Quick examples of the strong results. Why are we saying it's strong? Anyone, even 1, 2? Thank you, Tegbara, to hear that these are helpful. Okay, maybe we move to the next slide. So Vonai says the following were provided: sample size, location, time, detailed analysis of the results, including statistical analysis. Thank you very much. So again, we are highlighting in yellow. If you recall in the previous method section, the authors said they collected output data. And here you see the Indeed report on the number of sessions conducted and how many people were reached during what time period. Second, also in the previous method section, the authors explained they conducted mobile phone surveys to measure intermediate outcomes at the baseline and monthly follow-ups for pre-post analysis. In here, we see they've done a nice job of presenting the results from both the baseline and the final survey, including p-values to indicate statistical significance of the changes they saw since baseline. Next. Finally, the conclusion section. So it should be about 2 to 3 sentences long. And as for the format, you can start by stating the main messages of your work. Why are the findings important? Then consider providing meaningful reflections on the results, lessons learned, and what worked or did not work. And with a recommendation. What will be the next step if the work were to continue? When you write, you need to be focused. Do not make statements that are not directly supported by the results presented. Statements that are based on other knowledge that is not included in the abstract should not be used. And also you need to be reasonable. Do not overstate the impact of the findings and do not direct others to take a specific action from your conclusion, from your results. Think about scale. Unless your work was done on a very large scale, it is unlikely you can reasonably conclude that the work should be implemented globally. Instead, conclude with reasonable next steps. For example, what will be the next steps to increase the scale? Then let us look at our example again on the week conclusion. It says community health workers should be trained appropriately and given tools to meet client needs. This approach should be scaled up nationwide and can increase antenatal clinic and prompt care seeking behaviors. An example of a strong one, conclusion, it says results from this intervention suggest that when community health workers are provided with appropriate training and tools that can be tailored to client needs, they can positively affect the factors that influence uptake of ANC and prompt care seeking among communities they serve. Evaluation of behavioral outcomes can be considered in future implementation. So again, coming back to you, can you volunteer typing in the chat what you think makes the second version of the abstract better? Clear conclusion of findings and future knowledge required. Thank you, Vonai. Anyone else? Okay. Next slide, please. The strong one did not overstate the impact of the findings. Thank you very much. So highlighted in yellow, firstly, the conclusion section is 100% based on the information that had been presented earlier in the abstract. There is nothing noted here that draws from the knowledge external to the abstract. The first sentence contains the main message, and the authors use the word suggest, which keeps the language reasonable and not directive. The authors then state that when community health workers can better tailor their activities to clients' needs, they can influence the intermediate factors. That is exactly what their results showed. They found increases in perceptions of malaria risk and self-efficacy. Note that the authors do not state that the intervention can increase the behaviors of antenatal care attendants or prompt-seeking behaviors. They cannot make such a claim because those behavioral outcomes were not measured, among other reasons, such as the study design itself. Finally, the authors provide a recommendation for future implementation of this community health worker-based activity. They could find a way to evaluate the behavioral outcomes. This could be a reasonable next step. Next slide, please. So I hope you have found this helpful, and thanks for participating in the chat. I will now pass the floor to Gabrielle to summarize all of this and give some overarching guidance. Thank you.
Thanks, Lulu, and thanks for all of your inputs in the chat. Next slide, please. So just a few final tips. Here are some overarching best practices for abstracts. Make sure each sentence clearly articulates an idea So make each sentence count. There shouldn't be any sentence in there that isn't necessary. Also ensure that your information flows logically from each sentence to the next. Again, we're building not only section to section, but sentence to sentence. Always make sure that there aren't any errors in grammar, punctuation, or spelling. That really helps the reviewers fully appreciate your work, because then they aren't trying to figure out what you were trying to say or distracted by such errors. As we mentioned at the beginning, think about your title, make it short, catchy, creative, and finally, be brief. This is crucial because there is a character limit, and the system will not accept characters in excess of the limit. The system will actually cut off any additional text. So make sure that you have done your due diligence and checked the characters before you hit submit. Finally, as we mentioned before, every sentence should provide essential information. And to help you be brief, think about what is most important and report only on that. And one thing that I have learned every single time I've ever worked on an abstract, it requires many revisions. Rework it, refine it, revise it. You'll be surprised how many times you'll go through it and how each time you can find ways to improve it and make it stronger. Next slide, please. So to wrap up, let's look at our big picture for one last time. So I hope it's more clear now, after all of the suggestions that Lulu shared and that you also put in the chat, how each section of your abstract adds up to create a whole product that tells a cohesive story. And because each section needs to build from the prior section, there can be no information presented in one section that confuses or surprises readers, because it wasn't properly set up with a foundation in the previous section. So to help you when you're writing your abstracts, look at the questions we've provided here under each section to guide you. And remember that the entire abstract must stand alone, and the reader should not need any external information to fully appreciate the work that you're writing. And that's the magic to writing a strong abstract. Next slide, please. We just wanted to share one final note about co-author and donor approval of abstracts. So of course, while you're writing your abstract, you will want to request feedback from colleagues. In addition, as it's a best practice to confirm that all of the co-authors on your abstract are in agreement with the final abstract text before you submit. And then one other note, if your work is donor funded, if what you're reporting on are activities that were funded by a donor, we recommend you check with the donor to see what approvals are required for the abstract. It might be that approvals are needed or not. We do know that abstracts that report on PMI-funded activities require PMI approval, and because that process can take a few weeks, we recommend you discuss with your PMI point of contact right away so you can be sure to meet the abstract deadline. Thanks. Now we will pause and we can take a few questions if there are any. So next slide, please.
Thank you, Gabrielle and Lulu, for those wonderful presentations. I have a few questions here. One big question, of course, is people asking for the presentation slides and the recordings. I will share the slides and the recordings with everyone, the entire SBC Working Group membership, on Monday. That will include a French, English, and Portuguese recording of today's call, as well as the slides in English, French, and Portuguese. Please do add your questions to the chat as you think of them. There's still a few minutes to ask questions. I will start with one question. So this is a lot of information that we need to include in abstracts, especially the methods, but there are so few characters and the character limits include spaces. It seems like it will be very difficult to include all of this information in such short, concise abstracts. How do we manage this? Gabrielle, perhaps you can answer this question.
Sure. So yes, that's a very good point. So first, in the tips that we shared today, we included a lot of points that to include into your, we noted a lot of different points that would make for a strong abstract, but we know that not all of them will be applicable. For example, not everyone will have baseline and endline data to report on. And I'm also seeing a question in the chat about should all abstracts have significance testing? Similarly, not all abstracts will have used data collection methods that permit significance testing. So it's not a requirement, but that makes it a stronger abstract. And so ultimately, we did share a lot of information to include, but please report on what you have. The idea is that these are, we wanted to, in this presentation to give you as comprehensive as possible tips and options, considering that there are so many different types of programs and different kinds of research that you all might be implementing. And I guess the second thought on this is that by using the analogy of each section being a building block that builds from one section to the next section, we're also trying to encourage you to remove extraneous, unnecessary information in the abstract. So anything that's not directly part of the storyline from the very beginning all the way to the end might not be needed. So that can help you cut down on characters. And when you start to read your abstract through that very, very focused lens, you might see that it's not as hard to stay within the character limits.
Thank you, Gabrielle. And please do continue putting questions in the chat, everyone. Here's another question. What are other next steps that authors might have recommended in the example conclusion section?
So for this one, they might have suggested ways to improve the community health worker training, community health worker performance, or the monthly phone surveys. However, to do this, they would have had to present data on challenges or weaknesses of the program in the results section. So I would say, in short, this will be some of the other next steps that the authors in our example have recommended in the example in the conclusion section. Thank you.
Thank you, Lulu. And thank you, Gabrielle, for the expert responses. I will go ahead and move on to our call for proposals for the skills building workshops. Our call for skills building workshops proposals opens at the same time as the call for abstracts. Our skills building workshops are intended to help members develop new or strengthen existing skills. The SBC working group is looking for experts to submit proposals for interactive workshops. These might include experiential learning, maybe they're hands-on, and of course, including group work. Many of today's abstract writing tips are relevant to the skills building workshop proposals. And workshop proposals are due on May 29th through the website, just like the abstracts. And I will put the link in the chat to the skills building workshop section of the website. Are there any last questions before we move on to today's closing? I'm seeing a lot of great comments in the chat. Thank you so much for all of the feedback and for all of the engagement when talking about strong and weak abstracts. I'm seeing one question here in French. I will read the English translation for Gabrielle and Lulu to consider. For a pilot research project on a community intervention, how do you make a summary? How do you make an abstract if you don't have factual data on the SBC activity? Can we just describe the SBC activities?
Thanks for the question. So just to make sure I'm following, it's a pilot, but didn't have previous data.
It looks like perhaps it is a pilot activity, and they want to make an abstract, but they don't have data coming from the SBC activity or on the SBC activity itself.
Okay, understood.
Apologies if I've misunderstood the translation.
So a few ways to tell a strong story when you don't have data about the activity itself. One is to discuss why you chose the approach to the SBC work. So what kind of formative data or maybe health facility data or your malaria indicator survey data, what indicated to you that there was a problem and that the approach that you're taking is the right one for that problem, and being able to explain how you did that that analysis and the development of the SBC activity. And then we do always encourage including some kind of data, even at least about what was done, over what kinds of activities were done, how many were done, where, what kind of participation. It's quite crucial to have that information. And as you're doing SBC activities, I think most of us would want to know how implementation is going, at least in terms of numbers. So I do encourage you to try to get that information. And then in the absence of other data, what could make for a good abstract is to reflect on what you have been learning as you've been implementing. Did something you think that was going to go very well not really work? Are people not engaging with the activities? Or were certain activities incredibly popular over others? Those are all different kinds of learnings just based on the implementation that can be really interesting to share in an abstract and then help you make decisions about what the next step would be for your pilot program to talk about in the conclusions. So I hope that helps.
Thank you so much, Gabrielle. I'm also seeing a question about asking questions regarding abstracts. Please feel free to email me anytime with your questions about the abstract platform. I'll put my email in the chat. At this time, we do not have Twitter or a different way to provide responses. The best way to get in contact with the steering group and the coordinator is by emailing ashley.riley@jhu.edu. Thank you everyone for today's questions, and thank you so much to Lulu and Gabrielle for your expert presentations and expert responses to these questions. And of course, thank you so much to everyone for your wonderful feedback in the chat. It's been very helpful to go through all of these strong and weak abstract sections. A few reminders on important dates. Don't forget to mark your calendars for the abstract and workshop proposal submission deadline. That is May 29th, right around the corner, even though it might seem far away. The review period will take place in June, and the abstract and workshop acceptances will be issued in early to mid-July. If you are interested in reviewing abstracts or skills building proposals, please fill out the form, which I will put in the chat here in a moment. And please note that reviewing abstracts fulfills one criteria for eligibility to run for the leadership of the SBC working group. And here's the link in the chat to the Google form to volunteer to review abstracts or participate in other planning committees for the 2024 annual meeting. Finally, there are several ways to stay in touch with the SBC working group. Visit the links on the screen and join our email list, visit our Springboard online community, or visit our website anytime to learn more about the working group, learn more about our partner working groups at the RBM Partnership, as well as our 2024 annual meeting. Thank you again, everyone, for joining today's abstract writing webinar. I hope that you found it useful, and I really look forward to receiving all of your great abstracts on the expert malaria SBC work that you're doing. Thank you again to our steering group, to today's facilitators, Lulu and Gabrielle, and to everyone for your inputs in the chat. Thank you, everyone.
Thanks. Have a great rest of your day. And good luck with your abstract writing.
Thank you very much for your comprehensive and interaction on the presentation. Thank you.